The route of administration of a drug refers to how a drug is delivered into the body. There are many routes that can be used for drug delivery, and the route of administration used is based on a number of factors, such as the chemical properties of the drug, the condition to be treated, and the urgency of the treatment, for example. The first group of routes of administration that we will discuss are called the enteral routes of drug administration. The enteral routes of administration are the simplest of the drug routes, and they involve in some way the gastrointestinal tract. So they can involve the mouth, they can involve the esophagus, the stomach, and the small and large intestines. So the enteral routes of administration are easily and conveniently self-administered. An example of an enteral route administration is the oral route, where drugs are delivered directly into the mouth. For the oral route administration, the drug is given in tablet form. From the mouth, the drugs will travel down the esophagus, into the stomach, and into the intestines. All orally administered drugs are subjected to metabolism in the liver, so that they pass from the gastrointestinal tract to the liver in the portal circulation, or specifically in the portal vein. And the liver enzymes here will inactivate a fraction of the ingested drug. So a sufficient dose must be given to ensure that an effective concentration of active drug leaves the liver and enters the systemic circulation to reach its target tissue. There is a slow onset of action of the drug, as it faces not only breakdown in the stomach, but metabolism in the liver also. And most small molecule drugs are given in this way. Another example of an enteral route of administration is the rectal route of administration, where drugs are delivered directly into the rectal cavity and are given as a suppository. But the drug has a very slow onset of action when given this way, as the rectum lacks villi found in the intestines, so there is less surface area for drug absorption, and absorption following rectal administration is often unreliable. This route can be used for drugs that are required to produce a local effect, to produce systemic effects, or in patients who are vomiting or are unable to take medication orally. The final enteral route administration that we will discuss is the sublingual route of administration. And for this route of administration, the drugs are delivered directly under the tongue. And drugs are also given in tablet form. When drugs are given in this way, the onset of action of the drug is very fast, as under the tongue there is a large blood supply. And also, the drug is bypassing the liver, and so bypassing metabolism. The next route of administration we will discuss is inhalation. So for inhalation, the drugs are delivered to the surface of the lungs. And drugs are delivered in the form of aerosols. So they're delivered directly to their target organ, the lungs. But the lungs also serve as a route of elimination, as drugs are exhaled. An example of drugs delivered in this way are drugs to treat asthma, which we call bronchodilators, and these are small molecule drugs. But drugs given by inhalation are usually partly absorbed into the circulation, and so systemic side effects can occur. The next route of administration is called the transdermal route of administration. And for the transdermal route, the drug is applied directly to the skin. So for the skin, we have the epidermis layer on top, underneath which we have the dermis layer, the layer below the dermis is a layer of adipose tissue or fat. And we call this layer the subcutaneous tissue layer, below which is the muscle. So for the transdermal route of administration, the drugs are applied directly to the surface of the skin. And these can be applied as a lotion or in patch form. This route of administration involves applying the drug to the skin, which is then absorbed into the bloodstream to produce a systemic effect. But only a limited number of drugs are fat-soluble enough to diffuse across the skin, and only small molecule drugs are suitable for this route of administration. The next group of routes of administration are referred to as the topical routes of administration. The topical routes of administration involve application of a drug to an epithelial surface in the body in order to produce a local effect. An example of a topical route of administration is application of drug to the eye, or more specifically, to the cornea. For this route of administration, the drug is delivered in solution form, and we refer to this as the ocular route of administration. So drugs are delivered directly to their target organ, the eye. Another topical route of administration is when drugs are delivered to the lining of the nasal cavity and to the epithelial surface within the nose. So drugs are usually delivered in solution form as a spray, and we refer to this as the nasal route of administration. And again, the drugs are delivered directly to their target organ, the lining of the nasal cavity. In this video, we have looked at routes of administration that are enteral, and so in some way involve the gastrointestinal tract, and also routes of administration that involve applying the drug to a mucus or epithelial surface in the body. Next, we will look at other routes that involve administration of a drug through injection or infusion.